Hypertensive heart disease. Hypertension, the most common cardiovascular disorder in this country. It affects more than 20% of the adult population. It results from a prolonged elevated blood pressure in the vascular system, which forces the ventricles to work harder to pump blood. High blood pressure is indicated by blood pressure reading of 140 over 90 millimeters of mercury or higher. A normal blood pressure is below 120 over 80. The first number or systolic reading reflects the blood pressure when the heart is contracting. The second number or diastolic reading reflects the blood pressure when the heart is relaxed between contractions. Primary or essential hypertension is the most common type of hypertension. Its etiology is idiopathic. Secondary hypertension results from diseases like kidney disease, atherosclerosis, and hyperthyroidism. Malignant hypertension is a rare, severe, life-threatening form of hypertension that involves a blood pressure reading of greater than 200 over 120. Aggressive intervention is mandatory to reduce the blood pressure. Congestive heart failure. CHF occurs when the heart is unable to supply enough cardiac output to meet the body's metabolic needs, and the blood backs up to congest the lungs. The most common conditions leading to CHF are cardiac ischemia, severe hypertension, valvular regurgitation, aortic stenosis, and cardiomyopathy. Congenital heart disease. CHD is a result of abnormal development of the heart in the fetus. Common congenital defects or abnormalities can usually be surgically repaired and can include the following: atrial septal defect (ASD) is a hole in the interatrial septum. Ventricular septal defect (VSD) is a gap in the interventricular system. Patent ductus arteriosus (PDA) arises from a failure of the ductus arteriosus, a normal blood vessel in the fetus, to close within 24 hours of birth. Coarctation of the aorta is a narrowing of the aorta anywhere along its length. This causes hypertension in the arms behind the narrowing and hypotension in the lower limbs and organs, like the kidney, below the narrowing. Tetralogy of fallout (TOF) is a syndrome in which four congenital heart defects prevent enough blood from reaching the lungs. TOF occurs in about 5 out of every 10,000 newborns. Babies and children with TOF have episodes of cyanosis and are often called blue babies. Treatment is with open heart surgery soon after birth or infancy. Blood tests. A lipid profile helps determine the risk of CAD and compromises total cholesterol, high density lipoprotein (HDL), good cholesterol, low density lipoprotein (LDL), bad cholesterol, and triglycerides. Troponin I and T are part of a protein complex in the muscle that is released into the blood during a muscle injury. Troponin I is found in heart muscle but not in skeletal muscle, which makes it a highly sensitive indicator of a recent MI. Diagnostic tests. Several diagnostic tests are used to measure heart health. An electrocardiogram, ECG or EKG, is a paper record of the electrical signals of your heart. Cardiac stress testing is an exercise tolerance test that raises your heart rate through exercise like jogging or on a treadmill, and monitor its effect on cardiac function. Nuclear imaging of the heart, which involves the injection of a radioactive substance and can be used with stress tests. Echocardiography uses ultrasound waves to study cardiac function. Magnetic resonance imaging (MRI) can produce detailed images of the heart and identify sections of cardiac muscles that are not receiving an adequate blood supply. Cardiac catheterization detects pressure and blood patterns in the heart. A thin tube is inserted into a vein or artery and is then threaded into the heart under X-ray guidance. A coronary angiogram uses a contrast dye injected during cardiac catheterization to identify coronary artery blockages. Treatment procedures. The most immediate need in the treatment of MI is to get blood and oxygen to the affected myocardium. This can be attempted in several ways. Injection of blood clot-busting thrombolytic drugs. These drugs are interjected with 3.5 hours of the MI to dissolve the thrombus. Artery cleaning angioplasty. Percutaneous transluminal coronary angioplasty, or PTCA. A balloon-tip catheter is guided to the blockage site and inflated. The inflated balloon expands the artery from the inside by compressing the plaque against the artery walls. Stent replacement. To reduce the likelihood that an artery will close up again, a wire mesh tube or stent is placed in the inside vessel. Drug-eluting stents are covered with a special medication to help keep the artery open. Cardioversion and defibrillation have been discussed earlier. Radiofrequency ablation. It uses a catheter with an electrode in its tip that is guided into the heart to destroy cells from which abnormal cardiac rhythms are originating. Coronary artery bypass surgery. Healthy blood vessels harvested from the leg, chest, or arm are used to bypass the blood around blocked coronary arteries. Heart transplant. The heart of a healthy deceased person donor is transplanted into the recipient after the recipient's deceased heart has been removed. Okay. Cardiac pharmacology. Clinically, there are 8 types of cardiac drugs in use. Anticoagulants are drugs that reduce susceptibility to blood clot formation. This can help prevent deep vein thrombosis, pulmonary embolism, myocardial infarction, and stroke. Chronotropic drugs alter the heart rate. Positive chronotropic drugs such as epinephrine, norepinephrine, and atropine increase the heart rate. Negative chronotropic drugs such as quinidine, procainamide, lidocaine, and propranolol slow the heart. Inotropic drugs can be positive and negative. Positive inotropic drugs increase the force of the ventricular contraction to increase cardiac output when the function is impaired, as in congestive heart failure, cardiogenic shock, and cardiomyopathy. Digitalis and its derivatives, digoxin and digoxin, are the most effective positive inotropic drugs. The rest of the types of clinically drugs that aid in cardiac are antiarrhythmic drugs, vasoconstrictor drugs, vasodilator drugs, diuretics, lipid regulating drugs. Moving on. The circulatory system. The term circulatory refers to your heart and blood vessels. It has 2 major divisions. The pulmonary circulation, which carries deoxygenated blood from the heart to the lungs and returns oxygenated blood to the heart. And the systemic circulation, which supplies oxygenated blood to every organ except the lungs, and then returns deoxygenated blood to the heart, which pumps into the pulmonary circulation. Functions of the circulatory system. The circulatory system has the following three functions. Transportation. It carries oxygen, nutrients, hormones, and enzymes that diffuse from blood into the cells. Waste products and carbon dioxide diffuse back from the cells into the system and are carried to the lungs, liver, and kidney for excretion. Homeostasis maintenance. The systemic circulation directs blood flow to the tissues to enable them to meet their metabolic needs. Blood pressure regulation. In the systemic circulation, the artery's ability to expand and contract in coordination with the systole and diastole of the heartbeat maintains steady flow of blood and blood pressure to the tissues. Arterial pulses. The pulse is always part of clinical examination because it can provide information about the heart rate, the heart rhythm, and the state of the arterial wall by palpitation. The most easily accessible artery is the radial artery at the wrist, where the pulse is usually taken. Blood pressure, BP. Blood pressure is the force of the blood exerts on arterial walls as it is pumped around the circulatory system by the left ventricle. The pressure is measured using a sphygmomanometer and a stethoscope, usually at the brachial artery. Arterioles, capillaries, and venules. As the arteries branch further away from the heart and distribute blood to specific organs, they become smaller, muscular vessels called arterioles by contracting and relaxing. These arterioles are the primary controllers that help body direct the amount of blood and organs and structures receive. From the arterioles, the blood flows into capillaries and the capillary beds. Red blood cells flow in a single file through small capillaries. From the capillaries, tiny venules accept the blood and merge to form veins. The veins form reservoirs for blood. At any moment, 60 to 70% of the total blood volume is contained in the venules and veins. Systemic venous circulation. There are three major types of veins: superficial, such as those you can see under your skin of your arms and hands; deep, which runs parallel to arteries and drain the same tissues that the arteries supply; and venous sinuses, which are in the head, the heart, and have specific functions. Case 3, Report 6.3. Mrs. Martha Jones, who had been referred to Dr. Banerjee's Cardiovascular Clinic, has several circulatory problems related to her diabetes and obesity. She was diagnosed previously with hypertension, CAD, and diabetic retinopathy. She now has severe pain in her legs when walking. Doppler studies and angiograms showed significant blockage of blood flow due to arteriosclerosis of the large arteries in her legs. This blockage produces a pain when walking and is part of her peripheral vascular disease, PVD. The ulcers on the edges of her big toes are a result of thickening capillary walls and arterioles. This has led to poor circulation in her feet. Mrs. Jones' diabetes has caused these problems. In addition, in her left leg's venous vein system, the tender cord-like lesion is due to thrombophlebitis of a superficial vein. A venogram showed a deep vein thrombosis, DVT. Disorders of the vein. Our veins and arteries can be prone to certain disorders like DVT experienced by Mrs. Jones in the preceding case report. Thrombophlebitis is inflammation of the lining of a vein, allowing clots, thrombi, to form. Deep vein thrombosis, DVT, is a thrombus formation in a deep vein. The increased pressure in the capillaries due to back pressure from the blockage blood flow in the veins create a collection of fluid in the tissues called edema. A major complication of thrombus clot formation is that a piece of the clot can break off in bolus and be carried in the bloodstream to another organ, where it can block blood flow. It often lodges in the lungs, causing a pulmonary embolus or mass. Varicose veins are superficial veins that have lost their elasticity and appear swollen and tortuous. Their veins become incompetent and blood flows backwards and pools. Smaller, more superficial varicose veins are called spider veins. The treatment offered include laser technology and sclerotherapy, in which solutions that scar the veins are injected into them. Collateral circulations develop to take blood through alternative routes. A phlebotomist is a technician who draws blood. Disorders of the arteries. An aneurysm is localized dilation of an artery, and this commonly occurs in the abdominal aorta. Aneurysms can rupture, leading to severe bleeding and hypovomic shock. Surgical repairs consist of excision of the aneurysm and replacement with a synthetic graft. Intracranial aneurysms are an important cause of bleeds into the cranial activity and brain tissue. Thromboangiitis obliterans, or Buerger's disease, is an inflammatory disease of the arteries with clot formation, usually in the legs. The occlusion of arteries and impaired circulation lead to intermittent pain when walking, and a person will often limp to compensate. Raynaud disease is episodes of spasm following exposure to cold of the small arteries supplying the fingers, hands, and feet. It can be associated with connective tissue disorders like scleroderma and lupus. Carotid artery disease affects the carotid arteries, the two major arteries supplying the brain. They can be involved in arteriosclerosis and the deposition of plaque. This puts the brain patient at risk for a stroke. A carotid endarterectomy can be performed to surgically remove the plaque.